Cardiovascular diseases are the #1 killer in the Western world. They are responsible for about 30% of all deaths worldwide. An important group within these cardiovascular diseases are diseases linked to defects in the heart structure, also called structural heart diseases. For example, leaking heart valves or blood clots in the left atrial appendage. These structural heart diseases traditionally were treated with open heart surgery, but nowadays they are treated minimally invasively by transcatheter procedures. These are faster, a fast recovery time, and also cheaper in nature. In the case of minimally invasive procedures, interventional cardiologists need to rely on medical images alone to make very important decisions. Making mistakes at that moment can lead to serious procedural inefficiencies or even life-threatening complications. This is where FEops HeartGuide makes the difference by giving implanters additional insights prior to the intervention. Starting from routine preoperative CT imaging, FEops HeartGuide will simulate the interaction of the implant with the patient-specific anatomy and will predict how the implanted device will behave during the implant. This will help the physician to evaluate different implant sizes and positions. FEops HeartGuide Predictive Preoperative Planning tool has developed workflows for transcatheter aortic valve replacement, left atrial appendage occlusion, mitral valve replacement, and pulmonary valve replacement. FEops HeartGuide is a unique cloud-based structure where physicians can upload the medical images of the patient to the cloud. They get downloaded at FEops and then we start processing them. And within 2 working days, you get access to the results, looking at the different what-if scenarios of different treatment options. So in this case, this is left atrial appendage where different implant sizes are implanted in that patient. And then we can really assess in detail what good sealing is and which implant would be optimal for this particular patient. So here you see the impact of positioning, but similarly, we can also look at size 1, 2, and 3 to assess what's the best option.
With the simulation tool or the patient-specific computer simulations from FEops, this offers a really new opportunity. Not only for me as an experienced operator, I can even optimize my pre-procedural planning, go for a more slick, even more safe and faster, or I use less contrast, I use less radiation, so it's a safer procedure not only for the patient, but also for me as an operator. But especially also my colleagues who would like to start with this procedure, you have a big amount of additional information pre-procedurally before starting your procedure. You get a bag of information which is unique, which you didn't have a few years ago. And this is what FEops adds to your pre-procedural planning. So this is a pure, unique pre-procedural planning based on a patient-specific computer simulation.
FEops is leading the way in creating this new market of predictive preoperative planning for structural heart interventions. We are the only company in the world that has a CE mark for simulation-based preoperative planning services, and we have filed our US FDA De Novo application in May 2020. To date, we have modeled more than 1,600 patients from 79 hospitals in 21 countries. Such a high number of patient-specific 3D heart models is unique in the world and gives us a competitive advantage for our planned AI-based improvements to FEops HeartGuide. FEops is a proud member of Dassault's 3D Experience Lab, and by collaborating with world-leading interventional cardiologists, we have created a solid scientific basis. Our technology is strongly protected by a combination of patents and trade secrets, and to fuel our growth, FEops has secured stable financing through experienced venture capitalists and prestigious European grants. This financing has helped us to bring together a team of 40 people, as shown here in the picture. This team consists of experts in computational biomechanics, 10 have at least a PhD, but also in regulatory experts, experts in AI, specialists in web development, and business and therapy development experts.
I believe that FEops can add substantial value, both market value and clinical value, to both companies that are involved in developing and marketing medical device technologies, and to the clinicians who are using these devices.
FEops is changing the way how transcatheter-based structural heart interventions are planned, and we are rolling out our pioneering FEops HeartGuide technology worldwide. FEops will continue to do this with visionary partners who share our belief that FEops HeartGuide predictive technology will assist in patient-centric care and help transform how structural heart implants are discovered, developed, commercialized, and used.